Hello, and welcome to the MediV Health Ed Advanced Care Paramedic Program Orientation Package. In order to better help prepare you for your program, we'd like to discuss a few components of our programs as well as the school itself. We're going to discuss the faculty as well as how the program was structured and designed to make it a better and easier learning environment for you, as well as the evaluation processes that you will go under while you are a student with MediV Health Ed. We'll also review the safety manual as well as the policies and procedures manual that you are required to look at prior to signing your contracts with the school. So let's first talk about the faculty and the different people that help you get through this journey. As a private career college, our goal is student success. To achieve that, we have a number of people that are in place to help you succeed, from our admissions team to the instructors and facilitators that take part in your program, to the people that take part in our quality and risk assessment to make sure that the programs that you are getting are up to date and accurate. Everybody is there to help you succeed. All of our faculty are registered with the Private Career Colleges Division of the Department of Labor and Advanced Education. They're also registered with our provincial regulators for ambulance services and are registered as either primary care or advanced care paramedics that have a minimum of 2 years experience. Our lead instructors for the primary care paramedic program are there to help deliver the content as well as support you through your journey with MediV Health Ed. We also have a number of facilitators that work under the direction of the instructor as well as the program manager. They assist with the preparation of equipment for simulation, delivering teaching materials during simulation, as well as evaluating you in your psychomotor skills. They may also monitor written tests when required, participate in final exams, as well as reviewing curriculum when necessary. The other great importance of our faculty, the facilitators or the instructors, is that they are great mentors to help you get through this program. Another important person to our programming is our medical oversight physician. Dr. McVeigh plays a large role in ensuring our curriculum is current and evidence-based. Besides her role with MediV Health Ed, she is currently an emergency physician with the QE2 Hospital in Halifax, as well as an oversight physician for Emergency Health Services in Nova Scotia and an instructor with Dalhousie University Division of EMS. Now I'd like to talk a little bit about the Advanced Care Paramedic Program itself. The Advanced Care Paramedic Program was developed by MediV Health Ed, but it also takes into account a number of different options. The first one is the National Occupational Competency Profile, or the NOCP. This is maintained by the Paramedic Association of Canada and is the foundation of all paramedic training across the country. It looks at all levels from emergency medical responder to primary care paramedic to advanced care paramedic as well as critical care paramedic. And it's this document that is the foundation of entry to level practice within this country. Ultimately, we want to prepare you to be able to successfully complete the provincial entry practice exams. So our testing, our materials, and our textbooks are all done to make sure that you have the most important and most up-to-date material possible for these areas. Keeping all that in mind, how did we develop our program? Well, our program was designed with 3 key concepts in mind. To discuss those concepts, I want to give you a little bit of a story. When my daughter was 4 years old, I trained her to be an advanced care paramedic. I did this for one specific reason, and that was to prove to the students that were in different programs that we had at the school that the skills and the techniques are not that hard to learn. They're easy enough that even a 4-year-old could learn them. But we want to make sure that you have enough information to actually utilize that stuff appropriately. And that's our first concept, and that was to make sure that you acquired the concepts and the theories of why we were doing these skills. Why did we start an IV on a person when they were ill? Why do we give this type of medication? It's very important to understand how the body works. What we're doing is going to fix those issues, and how does that interrelate with the items or the processes or procedures that we need to follow in order to treat our patients appropriately. Now, as a 4-year-old, she can learn the skills very easily. She can process them and make them very successful. Not a big deal. The problem she had, though, was that she wasn't able to understand why we were doing things. So even though she could see the skills practice the skills, repeat the skills sort of step by step, she didn't know what the harm was by doing something at a different time, or what were some of the drawbacks of that procedure. That's our second concept that we want to push with you, is mastering the actual skills that you're doing, and so that you understand the do's and the don'ts of what you're going to be doing as an advanced care paramedic. There are a lot of things that we can do that are going to help our patients, but if they're done at the wrong time or given to the wrong patient, they could potentially create harm. Now, while we are going to teach you how to do things, and we are going to teach you how to be very professional and very confident in the skills that you have, we also want to teach you when it's important not to do things, and maybe just take part in the patient evaluation, take part in the assessments, take part in the caring of that patient without having to perform procedures that may be detrimental to them. The last thing that we wanted to sort of push with you, though, is understanding that you are now part of a profession. And as part of that profession, we are part of the healthcare team. And it's not you as a paramedic once you graduate and successfully complete the provincial exam. It is you, your partner, the other coworkers that you are going to be with, as well as the nursing, the physicians, the respiratory therapists, and all of those people that take part to perform patient care at the different levels that we have. Now, while you are going to be part of the first response team, there is some expectation that you understand what you are supposed to do. Again, going back to my 4-year-old, she knew how to do the skills. She just maybe didn't know when to do those. And we had to build those concepts into our program so that you understand when things are important to be done. Overall, I think with these three concepts of getting the skills, knowing what that skill is going to do, understanding the anatomy of the human body, understanding how disease affects that anatomy, how do we prepare it, how do we repair the issues that are going on, and all those sort of things are very important. And we do it as part of a team. We take part in many different avenues of healthcare, and we just want to make sure everybody is part of that. Our success rates go back to graduates, and the graduates go back to paramedicine. And what I mean by that is you are going to become an asset to this profession by building on the community, but also being part of that team and helping the patient as you need to. So in order for you to get those three concepts effectively, we've broken our program up into 4 different areas. The didactic phase being sort of the classroom learning phase, as well as simulation, where we take you into the labs and demonstrate skills and give you scenario-based evaluations. Once those are completed, we then move you into the clinical phase, which for us is considered hospital-based, where it's a little bit more of a controlled environment with lots of resources and um, backup for you to help take part in patient care. And then as we finish off the clinical component, then we move you into sort of the workforce, if you will, in the practicum setting, where you'll be partnered with a paramedic crew and follow and take care of patients through those regular uh, shifts that they would be on. So let's talk about the didactic or classroom delivery portion first. So if you remember, I talked about the 3 concepts, one of those being obtaining the skills and the concepts and the theories, but the other one was to mastering those concepts and those skills that you were getting there. So in the didactic phase, we are going to give you a lot of information. We want you to understand everything that's going on, from the anatomy to the treatments to the assessment tools, and all of those sort of things are there. And we really promote for you to make sure that you're taking part in the lectures and everything else that's going on. So not only do you get an understanding of what's going on, but you also get some reasons and understanding as to how those things are working. For example, if we gave somebody a simple medication like aspirin, which you can get anywhere, right? You can buy it at corner stores or whatever. It's not a huge controlled medication. It's probably not a big deal in your mind. But if it's given to the wrong person, there is a potential that it can be harmful. It can cause bleeding. It may make them toxic if we give too much of those. So we need to know what's happening and why things are going on. In order to do that effectively, we want to make sure that you understand sort of the classroom environment. And the first thing in our classrooms is we want to make sure that everybody respects each other. Every human being of whatever origin or whatever station deserves respect. And we must give each other respect, even as we respect ourselves. So, understanding that in your classroom, there are going to be a number of different individuals that have different backgrounds, from family history to work history to educational history. Somebody may be coming right out of high school, while others have a degree or two from university, and others just went directly into the workforce after high school and have decided to have a career change. We all have a different aspect of what we're bringing to the classroom, and that respect allows you to have communications and learn from each other as we're going through that. The other component, obviously, is organization. This is a very busy program. In less than 12 months, you are going to go from orientation day to graduation day. Lots of information being forced on you, and I've sort of described this previously as being a 3-year degree or a 4-year degree program done in 6 to 7 months. There's a lot of dedication that needs to be done here, but you need to be organized. You need to be reading on time. You need to be taking part in lectures. You need to be scheduling yourself more appropriately. And that organization will show as you find your way through the program. As you do that, you do have to be dedicated. Dedication is not what others expect of you, it's what you can give to others. Okay? So, taking part in teamwork exercises, making sure that you are getting your homework done on time, approaching the instructor when you need assistance, all of that shows that your dedication towards the learning process and the program itself is set, and then it will definitely help you in the long run as we go through this, as I said, fast-paced type of program. And we also want you to make sure that you take a lot of knowledge in. We're going to teach you things that you may never see in your career, but there is a chance that you might. And we want you to be well aware of, the continuing evolving world of medicine. What we were doing 15 years ago as a paramedic in this province is completely different than what we're doing now, and those things keep on changing. So you have to have that foresight to be looking ahead, as well as understanding why you're doing things and not just following sort of a cookie cutter or a recipe type of approach to a lot of situations. Critical thinking or clinical thinking is a definite asset that you need as a good practitioner here within uh, Medivie Health Ed. Now, with that organization, respect, knowledge, etc., that we just talked about, you as a student do have responsibilities at the school. This policy here, which you'll see in the policy manual later on, is your code of conduct. And we want to make sure that our environments are safe and friendly and that everybody is getting along. So we want to make sure that as you represent this profession now, that you are acting in a way that is beyond reproach. We want to make sure that you are conducting yourself in a manner that would encourage and merit the respect from the different people that you're going to come in contact with, and also assume responsibility for that personal and professional development, further education, and things that are going to be continuously coming towards you as a paramedic in your career. Maintaining the standards of the school as well as the pre-hospital care community. Most of the general public won't know the difference when you're in uniform as to if you're a student or if you are an actual practitioner, and they look to you as a practitioner, and we want to make sure that everybody is okay with that. We have a lot of rules that are in place, and we just need to make sure that you are aware of them and follow those throughout your program. And then, of course, there are going to be code of conducts that you'll have in your career. So please, as we get to the end of this, make sure that you are looking at the code of conduct and understand the items that are there. This is one of those areas that we tend to come back to when we have problems with students or personnel, is the code of conduct. We also want to make sure that you are in an environment that is honest, and your honesty and integrity are an integral part of that academic achievement that you're going to be going through, yourself and your classmates. Keeping in mind that we've gone through a number of steps to minimize the ability of cheating on tests and those type of things. If you are noticing that things are happening as part of that code of conduct that we've discussed previously, it is your responsibility to bring that forward so that everybody can be treated the same way. Classroom time is scheduled from 9 to 4 each day. Keep in mind the time zone changes that you may be affected with, depending on the campus that you're in, Dartmouth or Saskatoon. Short courses typically are built into either online or given as part of the program, or you will be scheduled to attend specific dates within our program to cover off some courses such as ACLS or PALS. And the lessons that we have will continuously roll through the schedule, which you will be able to see. You can prepare and plan ahead for those. There are a few times, though, that we may have to start a little bit early, or we may have to go a little bit later than typically scheduled due to the content or guest speakers or something along those lines. Typically, we'll let you know about those ahead of time, but again, just plan on being there from 9 to 4, and most of the time, you should be fine. There are a few instances where we do things on weekends, but very rarely do we do anything that's not during the regular workday, if you will. And the schedule itself really is a living document. While it is put in place at the very beginning, and you'll notice on the schedule when you get a copy of it that your test dates are set, your clinical time will be scheduled a little bit later on, your practicum time will be scheduled a little bit later on, but the time zones are there. Everything for your program is laid out for you already. Sometimes due to guest speakers not being able to show up or changes of uh, something happening at the school where we need to move a lab session because we can't use that space or something like that will cause the schedule to change. We will give you as much notice as possible. The reason we put the schedule at the beginning, we want you to be prepared, organized, as we said earlier, so you can plan what's going on. And with that schedule, we also have a number of resources available for you on our Moodle site, which you will get access to as a student, that allows you to prepare and plan for all the different modules that you're going to be going through. So keep in mind, while the schedule is kind of set in stone, there are times that we do have to alter it to make sure that everybody's getting what they need. Now, the program itself follows the same processes once we start getting into the patient systems components, where we have a specific learning objective for that module, which is provided to you on the website under our program profile, and the referencing to the National Occupational Competency Profile that I mentioned earlier gives you an idea of sort of what's going to be covered in that topic. We'll then go through the pertinent anatomy and physiology of the normal system, and then with that relate medical terminology and the different terms that you may be using in that specific section. And then what is the normal function of that system? How does the respiratory system function? How does it correlate with cardiac and other systems within the body? Once that's done and we have a good understanding of that, we'll talk about the different types of medical and traumatic injuries that you may encounter that are affecting that specific system. How do we assess those to make sure that we've found everything that we need to or can, given our scope of practice? And then how do we treat it? What interventions can we actually do? And if they're not working, how do we troubleshoot that to make sure that we can do something a little bit more effectively? So we'll continuously do that as we go through the different modules. Now, besides the didactic information, as I said, we are going to be putting you through a number of different types of simulation. In simulation, you are going to have an opportunity to practice all of the skills that are within the scope of practice of the advanced care paramedic. With that practice, it may be with an instructor, it may be individually done or peer taught, if you will, or being evaluated by some of our facilitation staff. There's lots of time within the program to practice and lots of equipment available for you to practice. We want to make sure that you're doing it over and over again to the point that you just feel very comfortable with it. We want to have you not only confident in being able to do the skills, but we want to make sure that you are competent at doing those. And then once you have that, we put them into practice or integrate them into the actual patient assessment phase. So early in the program, we tend to do more skill-based type of evaluations. And then as we move into the program, they become more scenario-based, where we'll give you a patient, we'll give you a setting, and you have to do the assessment, figure out what treatments you want, and then troubleshoot it as you need to. So with our training sessions, we try to keep our instructor to student ratios consistent with what's happening at a national level. So for us at MediV Health Ed, while the lab days show up at different points throughout the program, you'll notice that they tend to follow at the end of the lectures for each of the modules. We have in the beginning, as I mentioned, a number of skills that you are going to have to learn. And when we're doing those, and it's not truly a test, if you will, or a complete evaluation, then we tend to have 12 students with one instructor. That instructor is walking around giving you tips and helping you and assessing you as you're doing all the different competencies that you're going to have to learn. As we move into the scenario-based formulations of our assessments, then we drop down to a 6 student to 1 instructor ratio. Now, while you are actually doing the scenario, it will be you being evaluated one-on-one, but you have 5 other people from your class that are part of that group that are going to either be watching the scenario take place, being your partner, or taking a role in the scenario and in some other fashion, so that everybody's getting a little bit of information from those. You are going to be completing skills and scenarios throughout your program, but it's your responsibility to make sure that you're stepping up and getting those done. We're not going to chase you down to get you in to do certain types of scenarios. You need to stay on top of what's being done and how we track them through our ComTracker app on your iPad. You need to make sure you're staying on top of the sign-offs and things that need to be done so that we know that you have completed that specific section. If you don't get them signed off, then we don't consider it complete, which means you may get extended because you haven't got all of that stuff done. So you need to stay on top of those as we go through. And obviously in your first few days of the program, we'll show you how to use that software and reiterate some of this information as well. So as I said, it is your responsibility to make sure that you're getting everything signed off by our facilitation staff or our faculty, and you guys will typically be given a lab room that is your lab room as a group, and you will be responsible for making sure you check the equipment and the gear and everything that's supposed to be in that room on a regular basis. We consider that sort of a truck check if you were thinking of the working environment as a paramedic. And as I said earlier, most of the time we're Monday to Friday, but there are a few options and courses that may cause us to have to do some stuff on the weekend. You will have a number of skills and scenarios that you end up having to do as a student. While our focus obviously is on the advanced care scope of practice, we do have to keep in mind that your PCP or primary care level training is still a large component of your abilities. So there are sections within the NOCPs where we are required to evaluate you at the PCP level. Now this is technically or typically done early in the program, but you will see these things still come up throughout the modules as we go through the program. It is your responsibility to make sure you're getting all these sign-offs completed and taking part in the scenarios to be successful and be able to move on to the clinical and practicum component. As part of the simulation process, you are assigned to a specific week within the ACP program. Now, while we are a little bit flexible with this, typically the group or the week that you are assigned is your group for the entire program. That way you can pre-plan, know based on your schedule when you are going to have to be at the campus to do simulation and just be prepared within the program. The flexibility, though, that we do offer is that week 1 is delivered the same way as week 2 is. And if there is a day that due to work, due to travel, or something like that, that you're unable to obtain or be at, you can potentially do the following week on the same day to get the same material. Now, while that is typically the result or the plan, there is always some variances to the schedule that might make that a little bit difficult. You can request which week you would like to be assigned to, and we will try to accommodate that as best as possible. But at the end of the day, we will end up having to place you into one of those 2 sessions. And if you have any issues or difficulties, then just reach out to your instructor. We can try to accommodate as best as possible. We do have a fairly strict attendance policy, and our attendance policy mimics what the Department of Education is promoting for all private career colleges, and that is that you must attend at least 90% of your program. That includes all of your didactic and simulation time, as well as clinical and practicum. But for us at Medivie Health Ed, 90% of didactic and simulation is definitely acceptable. But when we talk about clinical and practicum, we have an expectation of 100% attendance there. So in the classroom time, you need to be there on time. You need to attend classes, and we have a number of different ways that we track attendance, from the logging that you would do onto ComTracker to our instructors logging from their end. We need to make sure that you are there. If you miss more than 10% without valid reason, there is a potential that we will dismiss you from the program. With the distance learning program, we do recognize the fact, though, that you are potentially going to be working during some of the days that we are actually doing didactic lectures. For this, we built in a little bit of an allowance, and we will allow you to miss up to 40% of the online lectures based on work or illness type of excuses. If you happen to miss a class, we do have a way for you to go in, watch the live recordings of those sessions so you don't miss the material, and the instructor doesn't have to reteach it, and then sign a contract with us, basically through ComTracker, to let us know that you have completed that, and then we will give you recognition of that completion by giving you attendance, if you will, for that day. Now, while that does account for up to 40% of the online lecture time, it is highly recommended that you are present for all of the lectures, due to the ability to interact with your instructor, ask questions, etc. But if you do have to miss it, there is other ways, through email, through follow-up sessions, or something along those lines, that you can communicate with your instructor. As mentioned, on your schedule, you'll notice the dates for testing, and more specifically the modular tests, midterm, final exams, as well as the medical terminology items. While these dates are set in stone based on your schedule, we do again also realize that people are working and different things are happening. If the scheduled date for that test is going to be difficult for you, you're working, traveling, or something along those lines for work, etc., what you need to do is get a hold of your instructor. The instructor can then work with you to come up with a better time for you to do that test, typically, and probably need it to be done prior to the original test date. So if it's scheduled for a Friday, we would expect that you would try to make it either on a Wednesday or Thursday prior to that date, so that once everybody else has done the test on the date that it's scheduled, the results can be released and everything could be done with, so that people don't have to wait until everybody else is done in order to get their grades and evaluations. Okay, and then the last piece that we should talk about around didactic and simulation is the evaluations. You will be evaluated a number of times, from basic assignments that we give out in class to projects that might be done as group work or individuals throughout the program, as well as we have a quiz for every specific module, a test for every specific module within the program, and some of the short courses that we do, from medical terminology to CPR, or the basic life support from heart and stroke, all have tests built into those. Um, and then in the simulation side, we have practical exams, we have scenarios that you're going to be doing on a consistent basis that will have to be done. And then, of course, we have a midterm and a final exam prior to going out to clinical and practicum. And then when you are out in clinical and practicum, each of those have their own specific methods of evaluation that you're going to be going through. So for the modular quizzes, so for the ACP program, we actually have a total of 11 modular quizzes, because Mod 2 and Mod 3 are combined together for one quiz. This does not include quizzes that come from the short courses or any other part of the program, but this is specifically to our individual modules. These 12 quizzes total up to 5% of your overall mark. While our pass mark is 80%, there is no expectation that you pass the quizzes, but you do have to keep in mind that your overall grade, in order to move on to clinical and practicum, has to be 80% or higher. And this 5% can be the difference between having enough mark to move into clinical and practicum and not having enough, and having to potentially redo the program as a result of that. For modular tests, and again, we have 11 modular tests where Mod 2 and Mod 3 are combined into one single test. And the average of those 11 tests gets put towards your overall grade and accounts for 36% of it. There is an expectation that you pass these modular tests. Again, our pass mark is 80%. If you don't get an 80%, then we have to look at some options on how do we get that grade up. So with our modular test requiring a grade of 80% or higher, we know that there are some modules that you may not be as successful on. We wanted to give a little bit of a buffer for our students in those cases, because not everybody is going to excel in every specific module that we do. So we have two other options besides the passing grade of 80%. That's our project range, which sits between 75% and 79.5%, or our rewrite range, which is anything less than 75%. If you're between that 75% and 79.5%, you would be assigned a project from the instructor, and those projects tend to be based on the material that either you didn't do well on the test, or more specific to the overall module concepts that you would do, complete, and hand it into your instructor for marking. That mark will be graded out of 5 points, and those 5 points we would then add to your test mark. So if you had a test mark of 76%, we add 5 points to it. Theoretically, you should be getting 81%, but we cap it off because we've given you that extra buffer at 80% to get you to the overall passing grade for that specific module. We will allow you to do this 3 times throughout your program. So at 3 different modular tests, you can have a project based on if you are in the appropriate grade range that is listed for those. So if all three projects are used up, then everything that is considered within project range after that is automatically considered a rewrite. And with the rewrite marks, anything less than 75%, or you've used up all of your projects already, we will give you up to a maximum of 3 rewrites for your program. That is not per module. So if you fail a specific module and do the rewrite, that's the only rewrite that you can have on that specific module. The mark that you receive for that rewrite will be considered your modular mark. So the maximum achievable mark that you can get is 80%. So even if you got a 96% on the rewrite test, we're still only going to record it as 80%. But if the rewrite mark is below 80%, that doesn't mean that you're kicked out or you have to do another rewrite. It just means that we're going to put that mark in, for example, maybe 76% into that module, and then the overall average that you need to maintain for tests is 80%. So you're going to have to do better on subsequent tests as a result of that. The only caveat to that is if your rewrite mark is below 50%, so you've done a quiz on that module, you've taken part in lectures and everything else, you've written the test, and you've written the rewrite test and still got below 50%, we consider that not having the material or the information for that specific module, and we will require you to repeat that module. And unfortunately, based on the modular system that we have, that means you're going to probably have to repeat the program. So while that may sound a little confusing, what does that look like? So this is an example of a student that wrote 7 tests. The first test they passed, no problem. They got an 85%. They move on to module 2. On module 2, they got a mark of 76%, which is above our 75, but still below our pass. So they were given a project, which we'll mark here as project number 1. They wrote the third test, passed that, wrote the fourth test. This time they got below 75, so that's considered a rewrite. Mod 5, below 75, their second rewrite in place, and then mod 6, they were below 75. That was their third rewrite. So now they've used up all of their rewrites. The next test, in this case, was below the rewrite mark, so we have to dismiss that student based on academics. But if that mark was, for example, 76%, they still had 2 projects to use. Keeping in mind that the rewrites are the important piece. So even though you still have projects to use, it does not mean that you will successfully use all of them. If you fail the first 4 tests with all your marks being below 75%, that will be a dismissal. Now, I tell you this just because we need to prepare you that we do have a standard around those marks, but we want to make sure that you're passing the material and being able to move ahead. The midterm, which happens after module 6 and covers the first 6 modules of the program, will be calculated towards your final grade and will account for 27% of your final grade. And the final exam, which covers the last half of the materials from mod 7 to 12, accounts for 27% of your final mark as well. So if you were keeping track, our modular quizzes are worth 5%, the modular tests for 36%, and your midterm and final exam are 27% each. That accounts for 95% of your overall grade, but we also know that we're going to be giving you projects and different things throughout your program that will then be marked appropriately, and that will account for the last 5%. This is not the projects that you're given as a buffer if you did not get the 80% on a modular test. These are regular projects that are happening throughout the program. At the end of the simulation module, you will be required to pass a practical exam. This practical exam consists of not only skill assessments, but a medical and traumatic scenario. You will be evaluated with a partner, but you're evaluated on an individual basis during these assessments. You will also take part in an oral board exam. This is typically led by the instructor as well as the medical director. This may be done in class or virtually, depending on the needs. It is required to successfully pass all of these in order to move on to clinical and practicum. As we mentioned, there are a number of short courses that we do throughout the program. Each of these courses does have their own, typically an evaluation and a pass mark that is required to be successful. We will follow those and hold you accountable to those passing grades. And if you are unsuccessful in that program, you will have to potentially obtain that course at another time, either with our programming or at another location at your own expense. You are required to attend all of the short courses. If you miss it for some reason, you may have to attend that course on another program or get that course at another location. This could be an increased cost occurred to you or could delay your graduation. Learning contracts are an item that we do use at the school. These contracts are a way in writing for you, the student, and us as faculty to understand what is going on. In the case of a code of conduct issue or failures of a number of tests or problems within simulation, etc., we may have a meeting with you to discuss how can we assist you to improve the outcomes. In those cases, we would set up a learning contract so that you have a written record of what we've agreed to and what you've agreed to. As I alluded to earlier, clinical rotations is considered a hospital-based environment. Whether you're in the emergency department, ICU, you're experiencing interactions with patients, helping with assessment, helping with treatments, and getting more and more confident in the skills that you're allowed to provide. Typically, the clinical rotations would start after you've completed the didactic and simulation training, including the final exams. You'll be assigned to different preceptors and you will follow the preceptor schedules. This may include weekends and nights depending on the department that you're in, and you are required to obtain competencies while you are on these clinical settings. It is your responsibility to make sure that you are documenting them appropriately and getting them signed by your preceptor. Staying on top of your sign-offs is very important, especially in the clinical setting. While some of the clinical time may be completed prior to didactic and simulation components being over, this is typically not the case. We will schedule you with your preceptor. You will follow their schedule. And as I said, it may be nights or weekends involved. As part of our attendance, we do expect 100% attendance for all clinical and practicum time. If there's issues that you cannot attend, you need to get a hold of your clinical coordinator as early as possible. If you miss clinical time due to illness, and we were made aware of it prior to missing that time, it is usually pretty easy for us to reschedule you in that department to make up for the lost time. Unfortunately, this isn't always the case with some people, and if you do not contact us and we have to book these shifts afterwards, it can take us up to 3 months currently to replace those hours in a clinical setting. That will mean that you more than likely will not graduate with the rest of your class. So just to be clear, it can take us up to 3 months to reschedule any missed time. That's a mandatory requirement for us from the Ministry of Health and all the different health authorities that we work with. Missing that time may result in you being exited from the program. Or if delayed, graduation with your class will more than likely not happen. We'll review this information closer to clinical and practicum, but as you can see here, there are a number of different forms that you are going to be filling out while you're in the clinical practicum locations, and it is your responsibility to make sure that they are getting done. In order to do that, we track it through a system called Comp Tracker. That will be required to be on an iPad. A common question we get asked by applicants and students is about clinical rotations in their locations. In order for us to have a student attend a hospital for a clinical rotation, we do have to have a memorandum of understanding or a learning agreement with that facility. While we do have a number of learning agreements in place currently with hospitals in Nova Scotia, New Brunswick, Saskatchewan, etc., we do not have them in every province. If there is a location that you would like to attempt in order to attend your clinical and practicum at, we recommend that you contact our coordinators of the clinical rotations early into your program to see if we can get a learning contract in place. We cannot guarantee that this will take place, and in some institutions, this can take years in order to actually come to an agreement. We will not guarantee locations that we do not currently have a program agreement or an understanding with at that time of your program initiation. For your clinical rotations, we will be organizing time in the operating room, the emergency room, ICU, and labor and delivery. In total, you'll account for about 192 hours of your clinical time, keeping in mind that there are specific competencies that need to be obtained, and it may take more visits to those centers in order to get the competencies in place. Specifically, things like intubation that may take 4 or 5 rotations in the OR compared to the 3 that are actually originally scheduled. Once your clinical hours are completed, we will move you to the practicum setting. The practicum setting is the on-the-job training with the ambulance where you're partnered with 2 paramedics, one of them being your main preceptor. Once clinical is complete, you can be moved into the practicum component. The practicum component, we do request that you try to obtain a minimum of 12 hours per week based on your work rotations. We can have a little bit of flexibility if you're working 2 weeks on, 2 weeks off an industrial site, then we can compile some of those hours in the 2 weeks that you're off versus trying to move back and forth between your work site. Preceptors that you will be assigned to are scheduled through our clinical coordinator at Medavie Health Ed and not by you as the student. The operating company will work with the clinical coordinator to make sure that you are assigned to an appropriate preceptor. Now, you can request specific areas that you would like to go to, maybe closer to your region. We do have to take a number of things into account. The obvious first piece is that we have a learning agreement or an educational agreement with that service. The second piece is, does that service provide the level of care that you are going to need? And is the call volume big enough that you're going to be able to successfully get your competencies in the time frame that we have allotted for the practicum setting? Again, these are questions that we can answer early into your program, but if it's a site that you think you would like to attend that we don't currently have an agreement with, you should be coordinating that with our clinical coordinator as soon as possible. And again, I'll highlight, if we don't currently have an educational agreement with that operating company, we will not guarantee that you will be able to get placement at that location. We also schedule you for a minimum of 13 weeks. So no matter which province you are going to, which rotation you go under, you will be there for 13 weeks. Even if you get our minimum hour requirement within the first 10 weeks, you still are expected to stay for the last 3 weeks in order to have extra hours, as well as make sure that all your competencies are completed. While we do try to accommodate your requests for specific areas, it is up to the operating company as to what spots are available and which preceptors are available at that given time. We will ask you to give us a couple locations that you may be willing to go to, knowing where you have places to stay, what's close to your where you're living currently. That will be submitted, and we will try to accommodate everybody as best as possible, but that's not always possible. Again, it's a result of the operating companies. You could be expected to travel to other provinces in order to obtain practicum time. While that's not always the case, it is a rare but possible occurrence. Once you are scheduled, we expect you to attend 100% of those shifts. The only exception to those is if your preceptor and their partner are unable to be on the truck and the company does not have a place for you to go, they will either cancel your shift or send you home. If you're ill, as in class, you need to contact your preceptor, let them know that you're not coming ahead of time. Just not showing up is considered unprofessional and not showing respect to your preceptors. Again, 100% attendance is what is requested through Medivie Health Ed. As we saw in clinical, there are a number of competencies that you are going to have to obtain in the practicum setting as well. Now, while this number does not seem to be a lot, once you look at the competencies in the profile, you'll see that there's a number of different areas that have multitude of sub-competencies built into them as well. We track all of this through ComTracker. Again, we have a number of different forms to do it. We will review this prior to going out to clinical and practicum. And again, to remind you, it's 504 hours that you must complete. Your program completion requires that you have the hours at the minimum, all of your competencies signed off, and all of your evaluations from testing and everything being successful with that average of 80%. And again, just to be clear, we expect you to be at all the scheduled shifts that you are given for clinical and practicum. Now that we've talked about the structure of the program, including didactic, clinical, practicum, as well as the simulation piece, I just want to give you a little bit more information around some of the important pieces of the program itself. To help support the materials within the program, we will utilize a number of different textbooks that you are required to use. The three that we have shown as part of your emergency care on the streets by Nancy Caroline, expenses you will medical terminology textbook, and the anatomy and physiology textbook. Nancy Caroline's emergency care in the street typical day-to-day books that you are going to be using. Of the material, the emergency care in the streets covers off has the paramedic perspective as well as discusses medications, diseases, as well as injuries, etc. That we're going to be covering assessments, etc. That we're going to be using as a paramedic. Anatomy and physiology, medical terminology specific in each of the modules that we talk about, terminology short course, looking at the different systems and how they interact with the PCP, the courses, normal function of the body, and the anatomy and physiology or covers the diseases normal function, as well as some of the pathophysiology, still self-directed issues that may be revolving around programming, but it is a short. In addition to those three books, we also do use the geriatric education textbooks coming for emergency medical heart and stroke services or GEMS course, or the as well as the pediatric education for pre-hospital professionals. The coaching of the emergency vehicle operators course also has a textbook that you will textbooks that we do use. The readings are listed throughout the modules. ICS 100 and a couple of the materials covered as we go through the modules that are either electronic or attached to the program when you do them. That are done as part of that short course, and they tend to come closer to the end of the program. But we do recommend that you are reading them in conjunction with the modules that we're talking about. ACLS, PALS, BLS are all done around cardiac time, and we will have those short courses scheduled during those lab times with your instructors. For those that are slow readers, we do recommend that you maybe you're looking at this material a little bit early on into your program, so it's not overburdening you as you get closer to that module. And the same as our 12-lead ECG textbook and the arrhythmia recognition, there's a lot of material in those that is very useful to the students. And given that you already have a little bit of background in both of these, reading those throughout the program may be a better success for you than trying to cram all of those books into that one specific module. The pharmacology textbook we do provide is also a support document for you, but we also do have the Medivie Health Ed version of that electronically that you can utilize that follows sort of the best practices across the country and looks at the drugs and doses and those sort of things that we are seeing being used within this country. But the test questions and other materials and the readings, et cetera, do come from that specific textbook. And then as a support book for all of those materials, we do provide Medic's Little Helper. And this is a great little resource. It's a small book that can be carried, in your pant pocket or in your kit bag as you're going out. And it has everything from basic assessment to the advanced assessments, as well as things like ventilator settings and a number of other items. So it's a great little book or resource for everybody. And as I said, everybody will be getting all of these books as part of the educational package. While on campus, you are free to use our internet. The Medivy Health Ed student internet has a password of 01, repeated 5 times. If you're on the Saskatoon campus, then you'll have to obtain the Wi-Fi password from that group. Anytime you're in the building, this access will be available to you. Please utilize it for what it is. It is there to help you connect to the information you need for the program, utilizing the apps that we have built into the program. It is not meant to be a social media hub, and just refer to the policies around social media and internet usage while you're in the building. We also do not provide you with a personal email from Medivy Health Ed. We utilize the emails that you already have. I think most of us have enough emails already. So please make sure that we have the appropriate email that you're able to check on a daily basis. Most of our instructors will communicate to you through email, and our applications that we use, such as ComTracker, Exemplify for testing, or AMP Educator to look at your billing and student info, all require email connection. Initially, you're not going to have access to your uniforms. Those are going to be sized and ordered within the first week of the program, and then they usually don't arrive for another 3 to 4 weeks. In the meantime, we expect that the clothing that you do wear to the school is neat, clean, and presentable, and it should be relatively casual wear. We don't need suits and ties for the classroom. We do expect, though, that you're not wearing muscle shirts or cutoff shorts or any type of frilled pants along those lines. We do not accept ball caps or hats within the classroom, and no gym attire or skirts or dresses should be worn just due to the nature of the program, where you may be in class for 1 minute and out into simulation for the next. As a result of that, we want to make sure that you're safe and covered appropriately. Shoes are also an important thing. You should be wearing shoes at all times, especially when you're in the labs. Sandals are not permitted. We do not want uncovered toes in case something gets dropped. Once the uniforms do arrive, you will be wearing these throughout the remainder of the program. As a professional and as part of this profession, we want to make sure that you respect the uniform that you are wearing, whether it's from our classroom version of the uniform or it's the clinical and practicum version. Wear it with pride and understand that you must keep it clean, neat, and tidy at all times. During classroom and simulation components, you're going to be in a modified version of the uniform. You'll be wearing the tack pants, which should have a black belt or utility belt with it, black socks, and black footwear. Typically, you will receive a pair of steel-toed boots as part of your uniform package. That is our preference in all weather environment. The modification is the shirt that you're wearing. In this case, it will be a blue golf shirt with our cresting on it. And we prefer that you wear undershirts under the golf shirt as well, even in the hotter months. And that shirt should be either a dark blue or a black undershirt if possible. And we also do have sweaters that are a high-vis sweater that has our labeling and everything on it that you can wear depending on the weather during the program that you're attending. Now, while we do provide you with most of your uniform pieces, we do not provide you with the black belt or the black socks or the hats. You are required to provide your own black belt and black socks. If you wish to wear a hat, It has to be, in the winter months, a toque that has no labeling on it. It has to be black or navy to match the uniform. If you prefer, you can purchase at our admissions desk one of the Medivie Health Ed winter hats that just has our logo on it, and that should suffice. And those are around $20. We do not have ball cap accessories or anything along those lines. These are the only acceptable ones, in addition to your stethoscope, a pair of scissors, and a pen light. Near the end of the didactic and simulation session, we will put you through some testing, and at that point, you will earn the right to wear the clinical and practicum uniform attire, or wearing the uniform shirt. The only difference is that shirt, and this shirt is similar or exactly the same that the paramedics are wearing in the region that you're going to be in, so you look like them. As I mentioned, we will get you sized for your uniforms. Uniform Works is our distributor, and they will have you try on all the different components of the uniform to make sure it fits you appropriately, and they will order that size for you. If you order the wrong size, especially without trying it on, they may charge you a restocking fee for that. All the sizing that you're requesting is going to be on your specific form, and you will have to sign that so they can put that order in. Typically, the uniforms take 3 to 4 weeks to return once the order has been placed. Once the uniforms are in place, we will give you about 7 days to get things hemmed and ready to go. And then from that point on, you will be required to be in uniform for the remainder of the program. Any issues with the uniform, improper sizing, things falling apart, or anything along those lines, you will deal directly with Uniform Works for that. And please remember, while you are in uniform, what you represent. You are representing our profession, and in the public eye, you are highly visible, from the high-vis sweaters to just the uniform itself. And our profession is held in high regard, and your actions will affect all of us. So while you are in uniform, we expect you to act appropriately. No liquor stores, no going to bars or nightclubs, and no going to pubs, even for lunch, while you are in uniform. You must follow those strict procedures. One of our interesting policies is around cell phone use. Now, while we are a technology-driven program and we expect you to be using a number of different apps, having access to a number of different information platforms through the internet, we do also expect that you're paying attention in class as well as during simulation. So in the case of this picture here, if our student to the left is actually looking up a medication dosage or looking up information around an injury, then it's more than appropriate for them to be doing so. But if all she's doing is looking at her social media account while the other two are being assessed, then that's not acceptable. So make sure that you're using the technology at the appropriate times and not interrupting other people, as well as making sure you're paying attention to what's going on in the class. All of our facilitators and faculty have the ability to make it a no cell phone zone or no iPad zone if they find that things are being disturbed. The other thing that I will note is that if your cell phone goes off during a lecture or in class that's interrupting everybody else, we will give you a project as a warning to say, please respect the other people within your program. If your cell phone does it again, then we will give the entire class a project. And again, we are promoting technology, but we are also promoting respect. So if you have to have a phone call coming in, make sure your phone is on vibrate, and when the phone rings, take it out of the classroom and answer it. We're not going to hinder you that way, but just show a little respect for the other people in the course. As part of your uniform, we will be issuing you a photo ID. Besides your photo, it will have your name, your student ID, and the program that you're in. It is mandatory, especially when you are on clinical and practicum, that you are identifying yourself as a student, so your student ID tag must be worn at all times in uniform. Some students may wish to access the campus after hours to use the internet, have a place to study, or a place to practice some of their assessment skills. While this is allowed in all of our buildings, it is restricted to students only and you are required to be out of the building by 11 o'clock at night. That timing may change depending on what's currently happening in the area or policy around the campus. Also note that due to the setup of our campus in Saskatoon, after hours access is not permitted. This access is meant for people to get together for study groups or to have access to the information they need, such as the internet, etc. There is typically a bathroom or kitchen style facilities available to you while you're in those areas. That may just be microwave, water, and coffee pot or something along those lines, but you are kind of isolated in the building and what you can access. Simulation equipment is not available to you after hours unless faculty is present due to a safety concern. The other thing that I will note, currently due to COVID restrictions, we are unable to allow students in the building unsupervised. So after hour access has been stopped until further notice. I've spoke about the National Occupational Competency Profile a couple times during this session. It's highly recommended prior to coming to school that you look through this profile so you have a better understanding of what is actually contained in it. To get a copy of this, you can go to paramedic.ca, which is the website for the Paramedic Association of Canada. And under the Competencies tab, you will find a copy of this document or an electronic version that you can look at the individual sections of it. Again, it's our recommendation that you look at this profile because it does outline exactly what the expectations are for you at a national level as a primary care paramedic. I am also required to inform you of our refund policy. For whatever reason, if you wish to leave your program, the refund that you will receive is based on the timing of when you left the program. Our program is broken up into 4 quarters based on the hours of the program, including all 4 sections: didactic, clinical, practicum, and simulation. If you leave within the first quarter of the program hours, then you are entitled to 75% of your tuition back. If you've only paid a small amount, then you still may owe, because we are allowed to charge up to 25% of the tuition. This does not include your textbooks, uniform costs, technology costs, and minute costs that may have been done at the beginning of that. If you leave during the second quarter of the program, then we are entitled to retain 50% of the tuition, and anything that's paid over and above that 50% will be returned to you in a refund. Similarly, if you leave in the third quarter, we keep up to 75% of your tuition, and if you leave in the fourth quarter, then all of your tuition is due. This is an important thing to remember if you are concerned, having troubles, or thinking about potentially leaving the program. You need to look at the number of hours that you're in. If you decide to wait a couple of days to see how it goes and that puts you into the second quarter or the third quarter, technically that money is now being spent. So if you have any concerns, you should be talking to your instructional staff as early as possible. And if you are thinking of withdrawing from our program, then you need to talk to somebody as soon as possible so that we can make sure that you have all the information you need to make that informed decision. For programs in Saskatoon, our refunds are calculated a little bit differently based on the private vocational schools regulations. If the program is delivered less than 20% of the instructional hours, the school can retain 25% of the tuition payable from the student. If the program is delivered between 20 and 50% of the instructional hours, then the school may retain up to 60% of the tuition fees payable. And any program that is delivered more than 50% of the instructional hours, then the school is entitled to retain 100% of the tuition fees payable. As part of the orientation package, you'll notice that there are a number of documents available to you. One of those documents is the safety manual. It is your responsibility to review the safety manual for the campus that you are on. While the safety manual seems to be pretty straightforward in the case of fire, flooding, or something along those lines and how we handle the situation, but you have to remember as well that we have equipment on site that can be harmful. We have live devices such as our defibrillators that can actually deliver dangerous shock or energy levels that we need to make sure that you are handling those things safely. So please review through the safety manual prior to signing your contract. The document that you will see under the orientation section is the policies and procedures manual. It is your responsibility to review these policies prior to signing your contract so that you understand all of the different things that are being held accountable to you as a student, to us as a faculty, and the overall program itself. One of the questions we get asked quite a bit is around our success rates. I want to talk to you about 3 different areas of success from our programming, from graduation to the success on the provincial exams to the hiring process. Each of those are very important for you to understand. With our programming at the primary care level, we have very good success rates. Now, while we have an attrition rate of about 23%, typically, for those that reach graduation and move on to the provincial exams, we have above average in most cases success rates compared to the national average. So in 2019, Medivie Health Ed students had an 85% success rate on the provincial exams. The national average was 70%. In 2020, our success rate was 74%, with the national average of being 71%. For those that successfully completed the provincial exams and moved on to the hiring phase, we've seen in the last 3 years anywhere from 88 to 92% success rates in hiring. For advanced care paramedics, our numbers are a little bit different. Our attrition rate is typically around 5 to 10%. And for those that move on to the provincial exams, we have fairly decent success rates. In 2018 and 19, we had a success rate of around 73%, while in 2020, we had a success rate of around 85%. Hiring is a little bit different, as most people coming to us for advanced care paramedicine already are employed as a primary care paramedic, and they're just changing their roles within that company. So we look at that as being 100% success rate of hiring, but depending on the location, your service may not provide advanced care abilities, so you may not be able to work under that scope of practice. In those cases, we do see people moving to other areas in order to obtain employment. And again, in those cases, we're still seeing 100% success. We also realize that this profession has its downsides. It is a high stress environment, and you are going to be part of a number of different types of calls throughout your career. As a student, the added stress of student life, seeing things that you may not be prepared for, or taking part in high stress situations, we want to make sure that you are prepared. We do a number of things within our program to help prepare you and give you the tools that you need for that. One of the initial tools that we give you is access to our student assistance program through Chappelle Monroe. This program offers you, and technically your family, assistance when needed. It will help you in times of crisis, but also help you in times when you just need that little extra assistance. This is a completely confidential system. So if you contact them by email, by phone, or through the app, we are not informed that you have contacted them. This is their website, workhealthlife.com. Take a look at it, see what's available to you, and take advantage of it if you need it. They do also have a app version of that for those that prefer to have it on their phone. Lastly, I want to talk to you about the restrictions that are in place due to COVID. COVID has obviously changed the way we do things in a lot of different capacities. The school is no different. In order to make sure that everybody is safe, we do contact tracing twice daily within our building. Once you are accepted as a student, you will receive access to our Moodle page, and in the Moodle page, there is access to our screening tool. The screening tool will ask you a number of different questions based on your answers to those questions and the temperature that you are going to provide as well. It will let you know if you are allowed to enter the campus, if you need to isolate or self-monitor, and will also tell you if you are not allowed on campus. This is supposed to be shown to your instructor prior to enter the building. But if you wake up in the morning and you don't feel well, it's not wise for you to come to school to fill out the tool to find out that you're not allowed in and potentially take the risk of infecting people along the way. If you're not feeling well in the morning, I suggest you go through the app itself. And if it says you're not supposed to be in the building, then call your instructor and let them know you're not coming in. We would rather you stay at home and minimize risking anybody else, and we can accommodate you due to the illness at that time. Anytime that you are on campus, you are required to wear a non-surgical mask. This is at all times. The only exception is when you're sitting at your desk in your classroom and you are socially distanced appropriately from any other classmates. You can then take your mask off. If you get up to go speak to a classmate, talk to your instructor, or to leave the classroom, you must put your mask back on. This includes even going to the bathroom. When you're having lunch or on break, if you are socially distanced, you can take your masks off. The lunchroom is minimized to allow for proper social distancing. That's everything for the orientation. If you have any questions, feel free to reach out to our admissions team and they can answer anything that you need. Thank you, and we'll see you soon.